So doctor, all this list of drugs in status epilepticus management and their dosages also are the favorite question of the examiner, which you should not forget. Now what are the newer anti-epileptics? Lamotrigine, gabapentin, topiramate, levetiracetam, zonisamide, tiagabin, vigabatrin, you should be doubly sure about. Oh, Nanda Kumar Neharkar, thank you very much for a small donation. Good, good. 2 days back, I just introduced a super chat feature just for fun, whether it is working or not. I really don't mean it. Thank you for all the guys who are very affectionately donating 100 or 200 bucks. Thank you so much. But you really need not do that. You know, you all come to the class every day. You bring your friends to the class every day. I'm the happiest. And I always tell my colleagues, recently in the Association of Physicians of India, when we met, one of the senior physician, his son is also attending in your group. He said that, Dr. Sahab, we are all treating malaria and typhoid sitting in the OPD. At that time, you are taking the responsibility to create the more knowledgeable new doctors. So, the greatest gift you all have given to me is to be with me, to give me an opportunity to study along with you and spend a wonderful evening with you. Yes. Now, doctor, what are the 5 points you should know about lamotrigine? The lamotrigine's mechanism is similar to that of the carbamazepine, but it should not be used in children. It's a broad spectrum anti-epileptic. It has a half-life of 24 hours, which is a very, very important feature, and it is better tolerated than carbamazepine or phenytoin. And good thing is there is no negative effect on the cognitive function, especially children. If you want to use any anti-epileptic, they become very drowsy, become very difficult to manage in the school. So we always look forward for that anti-epileptic which does not affect the cognitive ability of a child, and lamotrigine has that special privilege, is what you need to basically remember. Then coming to the gabapentin. Gabapentin, it is an add-on to the first line of drug, and it reduces the seizure frequency in refractory partial seizures, and it can even be given as a monotherapy. Topiramate is fundamentally a carbonic anhydrase inhibitor. That is very, very important. Ravi asked a very good question. Carbapene's half-life. Somebody should check Wikipedia and quickly update him. Yeah, but was it an old question? Please remember, only if it is an old question, remember, otherwise don't. That is the most important thing. You should be quite limited to what are the things must to remember. You should be very sure. So I hope most of you have downloaded the UMedico app using the new notes feature. Yesterday there were a little technology bugs where all slides, all topics, same PPT was coming because of problem in the database. But they have corrected that, they have fixed that bug, and now you can check. You are having all the nearly around 70,000 PowerPoint slides which we used in all our lectures are all available. You can go bookmark it and then get the reminders, notifications, everything. I hope you will all enjoy that. Please give me a feedback how the notes feature is helping you, right, in the UMedico app. Now, doctor, topiramate is also a weak carbonic anhydrase inhibitor. Zonisamide also, especially in refractory partial seizures, it is the one which is, Snowbird is asking where to download go to the Google Play Store, type UMedico, and you get the app, just download it and you can start using the feature. Somebody help Dr. Slobarwani to download the UMedico app, new version. Then levetiracetam, it is free of many drug interactions. That is one of the major advantage which you should basically remember. It is used increasingly common in complex partial seizures, myoclonic epilepsy, etc. And it suppresses the kindled seizures, which is one of the special effect. Yeah. So Devanshi Thakkar is saying, if lamotrigine does not affect the cognitive function, why it is not preferred in children? Once more, you need to look at that entire toxicity profile. Like ethosuximide is very effective, but ethosuximide you cannot give because of its effect on the vision, and the children cannot report it. So similarly, the overall toxicity profile doesn't make it the levetiracetam. So I mean the lamotrigine not a preferred one, right? Now thiagabin, vigabatrin, how do they work? Thiagabin potentiates the GABA. It is added as a add-on to the partial seizures. Vigabatrin, it inhibits the GABA transaminase and it is effective in refractory epilepsy. Is